Hi, my name is Amy Cherstrom, and I'm a mother of three boys living in Avon, Ohio. Two of my boys have MPS II Hunter syndrome, which is a rare genetic disease. I'm talking to you today because my sons have had the fortunate ability to be in clinical trials over the last several years, 5+ years. My sons were diagnosed early. One as a newborn at 3 months old, he was able to begin treatment, and the other at 2 years old. We are desperate to get treatments out to this community. These treatments provide access to actually treat the brain and the central nervous system, which are critical components to life. One of the things that has been really difficult, and some of the clinical trials have actually failed over the years, is meeting the regulatory requirements to deploy this type of technology out to the rest of the community. It's been incredibly difficult. At diagnosis, my children were able to start the standard of care, which is a medicine that was approved back in 2006. This technology is well over 20 years old at this point, and there's new technologies on the horizon. Not only do my children need this treatment, but this technology platform, some of the technology platforms promise to unlock treatments for other rare diseases, some of the other MPSs, as well as Alzheimer's, PLS, ALS, some of the very, very difficult diseases to treat. So as a mother, I care that my children have gotten access to a standard of care that was available. I also care that they were and are incredibly grateful that they were able to access clinical trials. But for me, the end point of the trial is really that they're still alive, that they're able to walk and talk and gain skills that help them in life. One of my sons is doing so phenomenally well that literally Hunter syndrome is potentially undetectable. Undetectable. You wouldn't even know from interacting with him that he has Hunter syndrome. So we really need to get this out to the rest of the families and get this technology out there in the marketplace. And we really need the help of the FDA and the entire US government to get something like this out. We can no longer wait and struggle as time marches on and takes things away from these families and children. And I can't even imagine a world without a treatment. I can't even imagine a world where we are told that we have to stay on a treatment that's greater than 20 years old that doesn't address all the components of the disease. So please help us push this forward. We're counting on you. Thank you.